Hello, dear students. I am Dr. Umair, and we are going to conduct a lecture today regarding OET speaking. So, can you please give me your feedback in the chat section whether you can hear me properly? Please give your feedback. Okay. So, thank you so much. On behalf of OET Med Exam, I welcome all of you to today's lecture regarding OET speaking, and specifically, we will talk about the importance of empathy and feedback when we talk about OET speaking. So, students, can you see the screen clearly? I have shared my screen. Can you see it clearly? Hello, students, can you hear me?
Yeah, we can hear you.
Okay, thank you so much. So let's talk about OET speaking. What is it? What is the main purpose of today's session is that I want all of the students to know what is the importance of feedback and empathy. So basically there is a pet criteria when we talk about the marking of OET speaking. And I have seen in the mocks of speaking that many students don't take it in much consideration, when we talk about feedback and empathy. So basically, whenever you see a patient, when you talk to him in a clinical setting, you have to be empathetic and you have to take a feedback that what's going on. You have to develop a sense of communication and understanding between you and the patient. So we are talking about that today, and I would like to request the management team. Hello, Ms. Sabha, can you hear me?
Yes, sir, we can hear you.
Okay, so please make me the host so I can share the screen.
Okay, sure.
Hello, sir. You are co-host now.
Okay, thank you. Okay, so we will talk about the today's topic is importance of feedback and empathy in OED speaking, and I am Dr. Umair. So, as all of you know, that feedback is very important in every daily aspect of our life. When we are doing OED speaking, we have to ask the patient that how he is feeling or what he is understanding. Sometimes it happens when you tell something about the disease, or you break a bad news, or you tell about the sign and symptoms, or you reach to a diagnosis and you tell to the patient, sometimes they are in denial. So feedback is very important, and it is given very much consideration in UK and other developed countries. So in OET speaking, if you take proper feedback, then definitely you are going to score good marks. And if you don't give it much consideration, then definitely you're going to lack in your scores. So it is important to take feedback from the patient it is an important component in marking criteria, as I said earlier. So it helps to ensure that the patient is understanding the communication. So basically what they want, the OET, the purpose of OET speaking is to ensure that the student or doctor who is giving this exam is well versed with the things that the patient is suffering from. Okay, so it is very important in a clinical setting. So basically you are supposed to check whether the patient is able to grasp and understand the information about the disease. So if, as all of you must be aware with OET speaking, that there are role play cards. When one of you is, if you are going to appear in the exam, you will be taking the role play as a doctor, okay? And the invigilator will be the patient. So when you will be talking to the patient in OET exam, so if you will not be taking the feedback, then you will definitely going to lose marks. So how you can ask about the feedback? You can ask, if you have discussed about a disease, let's say about osteoarthritis, and you have discussed the signs and symptoms of the disease, and you have also discussed the management with the patient. So you will ask the patient that how he feels about it, how he feels about the diagnosis. Is he worried, or he has developed a good understanding of what has been discussed? So it will help in the overall satisfaction of the patient. And when you will satisfy the patient according to the according to your clinical knowledge and skill, then definitely it will have a good impact in your OET scores. So basically the purpose of this webinar is to instill or tell you the few examples of feedback sentences. So if the patient tells you that he has suffered from, morning stiffness and joint pains and some other sign and symptoms, and you have developed a diagnosis of osteoarthritis, so you can ask the patient, is that clear? I'm clear so far. How does that sound? So it is very important to say these sentences when you are doing OET speaking. You can say, I am clear till now. Do you think you can do that? For example, if there is a scenario in which the patient is a smoker and he is also suffering from ischemic heart disease, and you have counseled the patient regarding the smoking cessation, and after telling him the guidance and guiding him about the smoking cessation, you can ask him, do you think you can do that? Will you be able to quit smoking? So this will help in the bilateral flow of the information between the examiner and the student who is appearing in the OET exam. You can also ask the patient, do you feel comfortable about my advice? So in UK, there is a lot of consideration given. You cannot be judging the patient. If the patient says that I would not be able to quit smoking, then you can't say that you are a very bad person, you are not listening to my advice. So you have to ask the patient, do you feel comfortable with my advice? You can also ask, do you have any questions so far? Okay. So what is the purpose of these sentences? It will keep the conversation in an open-ended manner. Okay. It will be a bilateral flow of information, and two of you will be speaking rather than only you. All the speaking mocks I conduct, there are few students I have come across, they have very good accent and fluency, but they don't take feedback. So the purpose of today's session was to also tell you all that the feedback is very important. Then you can also ask, would you like me to tell you more about that? If you have developed a diagnosis of osteoarthritis, and there's a layman and you tell him that you're suffering from osteoarthritis, then you can also ask him, would you like to know more about this disease, or you are already aware with it? Okay, so it will help the flow of the conversation. So this is a very good diagram, it is self-explanatory about empathy. So empathy is a word, which is a whole universe in itself, and you have to understand the meaning of this word to know what it means. So basically, you have to ensure the patient that you understand his pain and the condition he is going through. Okay. So basically, whenever someone who is close to you, he suffers from some disease or some ailment, then you are concerned. So basically, you have to show your concern. You have to be sympathetic and empathetic about it. You cannot be indifferent in the OET speaking. If the patient says that he has a pain, you should and you must say that, oh, I'm so sorry to hear that you had to go through this pain. Like, you have to make him feel that you actually feel his pain. Okay. And moreover, you have to be as polite as possible as well. And it should reflect from your conversation, from your accent, from your words. Okay, the words and sentences you are going to use in a conversation must show that you are absolutely in the same shoes as the patient. It will help in it. Why we are focusing on it, feedback and empathy, is that because when you will incorporate these two things in your OET speaking, then definitely it will have a good impact in your OET scores, and definitely you're going to ace the exam with flying colors. Okay. So you can see there are two images shown in which there is a face, human face with purple, and in his brain is the miniature, next person's brain as well. And it is the same vice versa in the other picture. So basically, it means that the two persons are feeling the emotions of each other, whether it is happiness or pain. So whenever you are doing OET speaking, you must use those sentences that show you are feeling the pain of the patient. Okay. So it has been seen in some countries, when their patients are dealt very badly, and the patient doctors are not empathetic because of the tough duty orders and hectic routine or any other reason. But when you're talking about OET speaking or working in UK, you have to be very empathetic. It's a very important parcel of their society as well. So how are we going to be empathetic? We are going to use few sentences. For example, if the patient says that he has been suffering from knee pain, you can say that, oh, I'm really sorry to hear that. You can also say it must have been very painful for you. If the patient is suffering from something emotional, you can say that it must be very stressful for you. Okay. And if the patient says that he has lost someone very close to him, you can say that, I appreciate your fears, your worries. I know how you're feeling. I understand what you're going through. It must be very painful for you. I know it is not easy. Okay. So you can use these sentences, these terms. Basically, you have to cram these sentences, you have to memorize them, and you have to incorporate in your daily language so that when you appear in the exam, you use these sentences. Okay. So the basic one is, I'm really sorry to hear that. It must be very painful. It must be very stressful for you. I understand what you're going through. I understand your fears, worries, concerns, and condition. So these are all the things and words which you can incorporate in your language when you're going to be appearing in the exam. So here are the few more examples of empathy. You can say, I can totally understand your concern. For example, if there is a speaking role play and the patient says that, if he is a cricketer, and he has suffered from some sprain, and he is not able to, get back to the ground because of his injury. So what will be the, general response of the cricketer? He will say that he's worried that he wants to play again as early as possible. But when you look at him and do the exam and labs, and you are of the view that, it is not beneficial for him to return to the field as soon as possible. So you can say that, I can totally understand your concern, but given the condition of your joint or muscle pain or sprain, it is impossible to return to the field earlier. You have to take the bed rest of 2 to 4 weeks. So how do you feel about that? Okay, so basically these two things I have incorporated in a single scenario where if you're saying that I can totally understand your concern, it shows empathy, that you are feeling the pain of the patient. And when you say that, how does that sound? It shows it is going to represent the feedback you are trying to take from the patient, that what are his views, For example, he says that, no, doctor, he's very reluctant and he says that I don't want to take bed rest. There is a big tournament coming and I'm going to be playing in it. So you have to be again empathetic, you have to get to the point where the patient is in the same wavelength as you are. Okay, being a doctor, you are going to be managing him medically, clinically, and emotionally as well. So you can also say, I can understand what you're going through. If I were you, I would have felt the same. So it shows the empathy. So basically, it is the crux of the empathy, that if I were you, I would have felt the same. And you can also say that I know what you are coming from, what you're trying to say, I'm so sorry you have to go through this. So these are the few terms you have to use while you are talking to the patient in OET speaking role plays. Then next very important thing is reassurance, So for example, you can, if the patient is suffering from some disease and you offer him some, medical management, for example, a drug that can be very beneficial in that disease, the patient is, going to say that, will this medication help me, or this, if this disease is going to be fine soon, you can say that, let me reassure you that this disease is self-limited. Okay, so you have to reassure the patient, you have to provide the comforting words which will be going to console the patient, in from his agony and pain, So what is the purpose of discussing, such things to a great length? The purpose of discussing these things is that it, if you will incorporate the feedback, empathy, and reassurance in your language, then according to the marking criteria of OET speaking, you are going to be ranked very high, and you will be able to score good marks. Even scoring 450 plus marks in OET speaking is doable. It is not that tough. So you have to do practice. You have to do the, take the mocks, as we are offering at OET Med exam. We are also offering, OET mocks for speaking. If there are role play cards, and you do the mocks with the examiner, and you are provided with the feedback that what we are doing good and where you are lacking. So that is very important, that you practice the speaking role plays with your friends, and at the end you give the mocks. I will suggest to take you at least 3 to 5 mocks before appearing in the exam, so you know where you are lacking. So coming back to the point we were discussing is the reassurance. So when you're doing a conversation, for example, you are going to say 100 words, 100 sentences in a single role play, then all these examples I have given you, you can incorporate these terms or words or sentences in your language, which will, just garnish the beauty of your English speaking. So you can say that if the patient is, fussy about something, for example, he says that this medication gives me headaches. Okay. For example, as we discussed the scenario that the patient was suffering from osteoarthritis, you can say that you advise some medical management. For example, you suggested the patient takes paracetamol for it, and the patient says, no, I'm not going to take paracetamol because it is going to affect my kidneys and liver and something like that. You can say that, I can understand your concern. Please be rest assured that this is not possible, that this medicine affect your kidney and liver in the suggested doses. Okay. So it happens on if you take the doses at a very high level, but the regime we are going to advise you or prescribe you is at a very safe level. Okay, there's nothing to get alarmed about, So when the patient is fussy and you say to the patient that it is nothing or there is nothing to get alarmed about, he will be static for 1 second. He will say that this person is really, understanding what I am saying. You can also say that try not to worry. I'm sure that you will be better once we get this done or you recover. So these are the few examples that you can say for reassurance that honestly, I'm sure that you will feel better in a few days. So where you can use this sentence? For example, if the patient says that I am suffering from this condition of osteoarthritis from 1 year and you are giving me medicines, when I will be able to recover from it, then you can say that honestly, I'm sure that you will feel better in a few days. So it will help the patient to be reassured that he got what he came for. Okay, he also got the medical management, he also got the emotional support, and he was also reassured. So basically, whenever you are sitting in the exam and you are blank, after doing all the writing, reading, and listening modules, when you go for OET speaking at the end, you must keep in this in mind that you have to be empathetic, you have to be reassuring, and you also have to take the feedback from the patient as well. So basically, one thing I would like to add in it is that whenever you complete your OET speaking at the end, you should ask the patient that let's revise or let's discuss what we have learned today or what we have discussed today. Can you please tell me that what is the crux of our today's discussion or what was the main point of our discussion? You can say that. So you came in with the joint pain and you told me about the problems in your locomotion or mobility because of your knee pain. So I did an examination and I found that your findings were consistent with osteoarthritis, and I ran some tests and they were also consistent with the osteoarthritis. So as we have diagnosed you with osteoarthritis, I gave you and I suggested you or prescribed you anti-inflammatory drugs and painkillers for which you were reluctant at first, but we discussed and I reassured you that they are not going to harm you or your body and you will be good as soon as you will be, and they are going to definitely help you recover from your condition. So when you will summarize at the whole scenario in 3 to 5 lines at the end, so it will also help you to get good marks or scores in OET. So while following the same scenario, let's discuss what we have learned today is that first of all, we discussed about the feedback that whenever the discussion is going on you between the doctor and the patient, that the doctor have to take the feedback from the patient. Feedback sentences examples we discussed. Let me show you once again. You can ask the patient, is that clear? Am I clear so far? How does that sound? Am I clear till now? Do you have any concern? Do you think you can do that? Do you feel comfortable about my advice? Do you have any questions so far? Would you like me to tell you more about this condition or this disease? How are you feeling? How does that sound? Okay. So these are the feedback sentences examples. Then comes the empathy. So empathy can be shown with these sentences. Oh, I'm really sorry to hear that. It must have been very painful. It must be very stressful for you. I appreciate your fears and concerns. So moreover, you can also say, I can totally understand your concern. It is very important. It is a good example of empathy. I can understand what you're coming through and what you're going through. Or if I were you, I would have felt the same. I know what you're coming from. I am so sorry you have to go through this. I totally understand what you're referring to. Okay. So these are few examples you have to incorporate, and then at the end, you have to reassure the patient. that there is nothing to get alarmed about. Try not to worry. Your condition will be fine soon, or it is self-limited, or it will be fine when you if you follow my advice. And you can also say that your health is my priority. Okay, this is a very good line as well. So basically, today's webinar, I tried to convey my message that you have to be empathetic, you have to take feedback, and you have to be very, very reassuring. And definitely, if you follow this advice, you're going to score good marks. So, any questions regarding the topics we discussed today, you can ask. And I would like to advise you that you can only ask the questions which are regarding today's webinar, because this is an informatory webinar, not about it is not the practice webinar. So if you have any question about feedback or empathy, you can send us in the chat section. Please type your question in the feedback section in the chat section. Type your questions in the chat section and we will answer those questions one by one. If any student has any question regarding feedback, empathy, and reassurance, you can send it in the chat section. Please also note this contact number and the email address where you can reach us. You can ask us about the details, how we can help you, and how we can arrange the speaking mocks for you, where you will be talking to our mentor one by one, and one-to-one speaking practice can be done, and you will be given the proper feedback regarding that. So please note this contact number. So let's check what are the questions of the students in the chat section. One student has asked about the timer. So basically, approximately you are given 3 minutes to read the scenario and 5 minutes to do the scenario. And you can always take your
हेलो आप प्लीज जवाब दें, हमने कमेंट सेक्शन में क्वेश्चंस किए हैं।
Hi, dear students. Mentor has disconnected. I think there's some internet connectivity issue, so he'll join back and answer all your queries. Please bear with us. Thank you.
So sorry, there was a little error in the connection. So we were discussing about the timing, and I told you that it is not an issue and you don't have to worry about that. And I would like to request the students that please send your queries once again. One was regarding the breaking bad news. So the student asked that how to break the news. So if you have done your medical school in the final year, you will be well versed that how to break a bad news to the patient. But this is a complete whole new topic, and it needs little time to discuss it in detail. So we will conduct a new webinar regarding that. We will discuss it in detail that how to announce the breaking bad news, as this is a very important topic, and we will definitely consider it for our future webinars. So there's another question about. So Mr. Ahmed asked that in the last speaking test, the patient or the invigilator was not telling about the starting or ending time. So I want to remind you that you keep it in mind that you have 3 minutes to read the scenario and 5 minutes to act on it. So if you practice enough, then you will have no need to see the time. You don't have to see the time. Even if you're doing very good, and if your 1 to 2 questions are dropped and you're not able to complete it, then even then you can secure good marks. Even when I appeared in the exam, my scenario was very long and I was not able to complete it, and my 1 question was left, but still I was able to secure 470 marks in OET speaking. So you do not have to worry about the time, but I will advise you to complete the tasks as much as possible, because completing the task is very important as well. So focus on the practice, don't focus on time. So this is a very good question, that if we use such terms that they may sound monotonous, or they can be very recurring or repeating. But believe me, when you will practice all these sentences, all these 30 sentences, you will only be able to remember in 4 to 5 sentences in your conversation. So there is no harm in repeating those sentences. You have to be very empathetic. They know that your mother tongue is not English, and you are trying to, you are doing your best. So our goal is to, pass the exam. We don't have to focus on what will they think, it will seem monotonous. If you will use these sentences, then you're going to be pass the exam. So I don't know what was your personal experience regarding that, but what happens is that the invigilator starts the conversation and you are with him during the test, and you can always request him to give you a verbal clue that 30 seconds before the timing is going to end, and I wish you best of luck for your exam when you appear again. So don't worry, it will not happen again. And you just focus on your role play card and practice more and more, and practice ending in the whole scenario in 5 minutes. In this way, you wouldn't have to focus on the time. So I hope that you will be able to learn some new things from today's webinar. It was a very good webinar, and I believe that you must have learned new things. And if you add these things in your speaking, then definitely I believe that you're going to pass the exam with good marks. So thank you so much for coming in today. Have a nice time and best of luck for your exam. And don't forget to take our speaking mocks so you can know that where you stand in OET speaking. Thank you so much. Take care. Have a nice day.